Thank you, everyone. Thanks for joining us. If you are not on mute, please do so now, just so we don't get any background noise. Thank you. Well, welcome everyone. Welcome to past and current grantees. I see some familiar names on the call, and those who are new to Delta Dental of Colorado Foundation. Thanks for joining us today. We're excited to share more information about our open grant opportunity that will be launching April 1st. I'm Lori Casillas, the Manager of Grant Making and Programs at Delta Dental of Colorado Foundation. With me today are my colleagues who you'll hear from later, Mireya Chavez, the Program Officer for the Workforce Initiative, and Mara Holliday, the Senior Program Officer for Prevention and Early Childhood. Also on today's call is Veronica Contreras de Raya, who's managing the technology and webinar today. If you have any technical questions about Zoom, please message her in the chat box. If you have questions that come up during the presentation, we'll be holding a Q&A at the end, so feel free to post your questions in the chat and we'll get to those after the presentation. The webinar will be streaming on our website starting next week, and we'll also be posting our FAQs then. We'll also be sending out a link for you to provide feedback about today's webinar. Before we start, we'd love to learn who is on the call today. So in the chat box, please write your name, organization, and town or city and county you're calling from. Welcome, everyone. So we're going to go ahead and get started. Next slide, please. Let me quickly walk through today's agenda. You'll be hearing from our grant making team today about our initiative areas. We'll be digging a little deeper into the objectives of the initiatives and sample types of programs we'll consider funding. You'll also learn more about the details of our grant application and evaluation, as well as the program budget and request amounts. And finally, we'll share some key details about our process and timeline. Welcome, everyone. If you're just joining us, put your name, your organization, town and city and county in the chat box, just so we know who's here. Next slide. The mission of Delta Dental of Colorado Foundation is to elevate the well-being of all Coloradans by advancing oral health equity. And we do this through a variety of ways, including our grant making. In the next slide, our theory of change will illustrate how we see our role in addressing health inequities and improving oral health outcomes. Next slide, please. In 2021, we refined our theory of change to reflect the new direction of our work. After lengthy data mining, research, listening to communities, and understanding in greater detail oral health inequities, the foundation identified key focus areas and initiatives for our investments. The three priorities that surfaced to the top of our list were improving affordable, accessible, and comprehensive oral health care, addressing the prevention of caries among the youngest children and their caretakers, and increasing the racial diversity of oral health practitioners as a way to improve the oral health care for racial and ethnic populations most impacted by health disparities. Next, Mireya Chavez will share more about the Workforce Initiative and the funding opportunity for this area of our work. Mireya.
Thank you, Lori. Buenos dias, I'm Mireya Chavez, and I am leading our Workforce Initiative. Our goal through this initiative is to create a more racially and ethnically diverse oral health workforce that reflects the demographics of our state, resulting in further reduction of access to care barriers and increasing culturally and socially relevant oral health care delivery. Our focus population is communities of color with the desire to advance their careers in oral health care by pursuing jobs such as dentists, hygienists, and dental assistants. Currently, 92% of dentists in Colorado are white, non-Hispanic, and roughly 84%. Sorry, I don't know why. Oh, Roughly 84% of Colorado hygienists are white, non-Hispanic, while 40% of dental assistants in Colorado are people of color. Having said that, through this grant making opportunity, priority will be given to those organizations and programs serving students and adults from traditionally underrepresented communities in dental hygiene and dentistry. Next slide, please. The next few slides I'll be going through are meant to just give you a sense of what we are looking for. So if I don't touch on your idea or what you're looking to propose may not be up here or I don't say anything about it, fear not. Instead, please reach out and let's discuss. Want to invite those conversations. So through this grant making effort, we seek to invest in approaches that will increase enrollment, admissions, and graduation of people of color in oral health training and education programs. And so proposals should demonstrate impact towards these indicators, increase knowledge about the value of dental health professions to students seeking educational and training opportunities. So, why we need more representation and the value that care to persons underrepresented in this profession can really go a long way. Another thing we also want to do is obviously increase and support the readiness of students and working age adults. So, what does it take to get them really equipped and ready to pursue this profession? Is it we need tutoring? Just to give you an example, ultimately, we want kids to know what does that pathway look like? How can they get informed? And how can they be successful? So next slide, please. Again, this is not, this list is exhaustive of everything we're thinking, but this is to give you an idea of some sample approaches. Establish a student-centered career pathway exploration to services that connect students to resources and programs that include oral health career pathways. So basically the inclusion of oral health career pathways in those entrees that college and career advisors provide to students, or those that people where they seek to advance themselves, that they include the oral health profession in that. So another approach ultimately that we're looking to also see is, develop those strategic partnerships comprised of employers, education and training providers, and community-based organizations in key industries and this occupational sector. Again, there's going to be more in the guidelines, but ultimately the approaches that we're hoping to see is expose and engage students and adults from traditionally underrepresented communities in dental hygiene and dentistry to career pathways in dental health professions. All in all, the approaches should provide avenues for communities of color to enter the profession and access opportunities for advancement. Next slide, please. Once again, this is not an exhaustive list. This is just to give you an idea of the types of settings. So, schools, school districts, technical schools, community colleges, universities, community-based organizations, and workforce centers. But this could also be career and college readiness programs, mentoring programs, graduate school preparation programs. In short, we invite organizations with any program that connects students and education-seeking adults to career and educational development opportunities. And then the next bullet we have here as well are free resources. These are just some resources that we're hoping to you guys will access to get those wheels going on some ideas on if you want to set up that dental profession pipeline. My Colorado Journey is a website that provides information regarding careers in Colorado. But this link here that I'm sharing is specific to careers in dentistry in Colorado. And here you can find information about the pathways for each of the dental health profession, which in this case would be dental assistant, dental hygienist, and dentist. Another thing we are excited and we are working on is making available on our website a dental career pathway toolkit. What we identified is that there is a need for materials that have been vetted and refined and that contain accurate and concise information that is Colorado focused when it comes to dental career pathways in our state. So what this will contain or what this will look like, it will have data points on the demographics of the Colorado dental workforce and the population and oral health disparities. Where are those dental shortage areas? What are those needs in Colorado? It will contain also occupation profile, types of dental professionals, what they do, how to become one, and of course the career outlook for each of the three professions, supply demand projections, education requirements, tuition, what is the pay, where they can work, and what are those licensing requirements. Along with possibly adding in support programs available in our state, such as those financial assistance tools that could be a loan repayment program, scholarships. Also hoping to stand up all these pipeline programs, and add those as well that people can also see as a resource. And we will also be including the association chapters, Colorado Dental Association, Colorado Dental Hygiene Association, and hopefully we can get some chapters of the National Dental Association here, the Hispanic Dental Association, and the Society of American Indian Dentists. We do plan to share the news of when the toolkit will be available in our newsletter. So I encourage you, if you have not yet already, please sign up for our newsletter. I will go ahead and drop the link in the chat just in case you haven't. But with that, I will hand it over to Mara, who is leading our prevention initiative. Mara, take it away.
Thank you so much. Hi, everyone. My name is Mara Holliday, Senior Program Officer for the Prevention of Tooth Decay Initiative here at Delta Dental of Colorado Foundation. We know that oral health affects a child's overall health. As such, our initiative seeks to instill good oral health habits in early childhood to ensure a healthy mouth throughout life. We also know that good oral health is important for pregnant people. Individuals experiencing pregnancy may be more prone to gum disease and cavities, which can affect a baby's health. The Prevention Initiative will invest in programs that provide access to preventive services, education, or connection to a dental home to children who are underserved and or have limited access to oral health care. We will also fund programs that provide pregnant people with appropriate and timely oral health care. Our goal is to increase the number of children and pregnant people who receive preventive oral health care in accessible settings. Next slide, please. I'm going to talk through some sample approaches that could be undertaken within this initiative. As Media said, these examples are not exhausted, but they're meant to illustrate the spaces and places where your work and your thinking may align with our funding priorities. Introduce oral health services into a clinical or community setting. We'll talk about settings in the next slide, but think about how you can integrate and operationalize oral health within your organizations, either by enhancing existing programs or in brand new ways. This could be, for example, a dental hygienist coming into an early childhood center to provide screening, fluoride varnish, and dental home connections to kiddos. It could involve non-invasive caries intervention to kiddos like silver diamine fluoride, or it could be that you have a community clinic that can forge a new partnership with the childcare centers throughout the region through a mobile hygiene program or otherwise. Think about who are the likely and unlikely partners who can be champions of oral health in the community. How, through the integration of oral health services, can we raise the awareness about the importance of preventative practices to this population? The second bullet is really talking about behavior change. Maybe there is an awareness, but now we need parents and caregivers to understand their critical role in oral health outcomes for their child and change behavior. Maybe you have a home visitation program, a parenting education program, prenatal program, nutrition education program that you can add oral health components into with that really strong tie-in. How can we empower parents and caregivers to really understand the important role they play with some very simple changes in behavior, like a baby not sleeping with a bottle, or just even getting fluoride toothpaste on those little baby teeth at least twice a day? The third bullet is around enhancing integration of oral health into prenatal safety net services. Settings that pregnant people frequent, one of which is usually not the dentist for a myriad of reasons, are ripe for messaging to pregnant people about the importance of getting their teeth cleaned during pregnancy and that tie to healthy birth outcomes. Again, think about who are the trusted champions that are working with this population to carry this message that can influence behavior change. Let's go to the next slide. Now let's talk about settings. Oral health prevention can happen anywhere that is accessible for families. So for ECE settings, we know that quality early childhood education needs to have an oral health component. ECE settings can include early childhood centers, organizations that are working with family child care homes or FFNs, early childhood councils who are working with providers, schools, school districts, etc. Home-based settings, that could include home visitation programs, even in-home settings where telehealth can be provided for prevention. 2-gen approaches, such as parenting circles, prenatal groups, those can happen in any type of community setting. If it is a setting that is accessible and is removing that barrier of having to go to the dentist to get oral health prevention information and treatment, we really want to consider it. We will also consider clinical settings as well. I would like to note here that if you are a family resource center who is a member of the FRCA, Family Resource Center Association, and are applying under this initiative only, you must connect with me prior to applying. This is very, very important. Of course, we strongly encourage all applicants to reach out to their program officer before applying so we can help ensure alignment and support your organization in submitting the strongest application possible to our board. Finally, I've listed a few free resources here. Save these top 2 links if you are a child care provider or a clinician not already keyed into the free training and curricula that's available to you through our partners. Also, Delta Dental of Colorado Foundation has free worksheets and fun resources and materials in English and in Spanish that could supplement a more comprehensive oral health program or approach. I look forward to meeting with many of you. And with that, I'll turn it back over to Lori Casillas.
Thank you, Mara. So next, I'm going to talk about our place-based access to care initiative. The goal of this initiative is that all individuals have affordable, accessible, comprehensive oral health care across the lifespan. We've focused our place-based efforts in the East Metro Denver area and the San Luis Valley of Southern Colorado. Next slide, please. Before I move on, let me state that we are very aware that many communities across our state could have been a focus of our place-based initiative. But after assessing several factors, we identified 1 rural and 1 urban community to target in our place-based initiative. We identified the San Luis Valley, which includes Alamosa, Conejos, Costilla, Mineral, Rio Grande, and Saguache counties. In the East Denver metro region, that includes the neighborhoods of Montbello, Green Valley Ranch, Globeville, Elyria, and Swansea, and/or Northwest Aurora, which includes North Aurora, Hoffman Heights, Jewel Heights, and the Fitzsimmons neighborhoods. We'll also have a new program officer who leads this initiative, and she will start in early April. Next slide, please. The Foundation's theory of change illustrates the comprehensive investments in the place-based initiative. It is our desire to fund various strategies that improve oral health specifically and health generally across the lifespan. At the bottom level of the theory of change, you'll see the types of programs, policies, and practices that we're interested in investing. In the second row, you can see the focus populations of our funding. Ultimately, we want to support work that organizations and programs in the target communities are doing to eliminating barriers to healthcare, open access to services and coverage, and build systems locally that strengthen the pillars of the well-being and health of families and residents most impacted by historical and systemic disparities. We want to hear from you about how support from the Foundation will help you get there. And we know that there are many ways to respond to the needs of children, families, seniors, and other often overlooked residents of your community. Your proposal may align with 1, 2, or all 3 goals and 1 or more of the focus populations. While we will consider a broad range of requests, we're eager to hear from programs and providers that link to our long-term goals, cultivate collaboration between providers, advocates, government, and community organizations, make genuine effort to be informed by and listen to residents and program participants, and that meet the oral health needs, prevention, and education of those most impacted by health disparities. Next slide, please. Here are some sample programs and activities, but certainly there are many others beyond these. So for example, the integration of oral health education and prevention into existing services and programs, building a community of practice among dental and health providers to improve healthcare, including oral health for the most vulnerable of the community, instituting cultural and linguistic practices among providers and community-based organizations to improve access and user end experiences, conducting health assessments to inform the adoption of approaches to improve health outcomes, including oral health across the lifespan, training early childhood caretakers about ways to support good oral health practices in homes and other settings such as childcare centers, and teledentistry and telehealth for seniors, homebound residents, or others with transportation challenges. So as you can see from this list, there are expansive ways that we might be able to support your work. Next, I'll share more details about the grant opportunity in general. Next slide, please. Let me highlight some key points as you consider applying for funding. As we've said before, we will give preference to those programs that strongly align with our priority areas. We will consider multi-year requests. However, we may choose, depending on a variety of factors, to only fund 1 year to start. While we'll consider requests up to $100,000 a year, we will weigh your request with the amount, with your proposed activities and related costs. I'll share more about the program budget and request later. And finally, we will only fund not-profit organizations or those with a fiscal sponsor. Next slide, please. Let me go over the content of what you'll find in the grant application. First, we'll want to know what your oral health goals and priorities are and how you determine these needs. Also, what your expected outcomes of the program for which you're requesting funding from this foundation. Key milestones and activities will be important to know. We'll want to know what you're undertaking to achieve the health goals and priorities that you've listed above. We'll also want to know how your organization takes on program level evaluation and learning to inform how you develop, implement, and improve your programs. So basically, how do you define and measure success, and what do you do with that information? We'll also be providing technical assistance to grantees on evaluation if you find that you need that. We'll also want to know the demographics of the participants and community being served under this request. If you don't have that exact data, make your best estimate. We want to see the profile of the community and participants that are part of this proposed work. Also, if you have them, we want to know what your key equity goals and priorities are. And that's not limited to oral health. So we want to know how you chose these and what you're doing to address them. Next slide, please. Also, for those of you who've written grants, these are very standard bits of information we'll need, but we'll be asking for your current board approved organizational budget, the income and expense report for the year to date and the most recent year end, a balance sheet for the year to date and the most recent year end, and your most recent financial audit or review if you have them. And as a reminder, if you have a fiscal sponsor, you'll need to submit their financials as well. And please note that your request amount from us should not exceed more than 10% of the total of the organizational budget. Next slide, please. All applicants must submit a program or department budget, which shows the amount you will be requesting from Delta Dental of Colorado Foundation. Think of your budget as the monetary story of your program. We will provide a template for the broader program or department under which this request falls, but you are welcome to use your own template as long as they include the information that you see here. This will be on the platform. We will want to know how much of the total expected income you're requesting from Delta Dental will help carry out the activities that you've proposed in the application. We've also included a line item for indirect costs of the department or program under which the oral health work falls. In the narrative box, please provide a description of the expenses our grant will help pay for. That could include program staff positions or other expenses like materials, training, training of your team that you'll need to do the work proposed. To reiterate, while we do not have a limit on the percentage of the program budget that a grant from the Delta Dental of Colorado Foundation can cover, in most cases, we will not award grants that are more than 10% of the total organizational budget. Next slide, please. The next bullets, like everything else, can be found on our website along with other details, but let me go over a few key points to take in as you prepare your request. Final grant amounts will be informed by multiple factors, including alignment of the proposed program to the Foundation's priorities, the request amount relative to the oral health activities being proposed, and the amount of funding available relative to the number of grants approved. Please contact a program officer if you're seeking to request funding for more than one priority area under this grant opportunity. Grants that are approved will have a contract start date of September 1, and grant periods are 12 months. Organizations that were funded by us with a contract expiration date of 12/31/22 are encouraged to apply under this opportunity. And those same grantees, please include a full year budget and we'll prorate your request based on a start date of January 1. If this sounds confusing, it probably isn't, but what I would recommend is talking to your program officer. They'll walk through exactly what questions you might have, and I think you'll get clarity if you don't from this information. Next slide. Here's a list of things we will not fund. If you have any questions about this list, please let us know. And please note that while we will not fund capital projects through our grant making, we now have low interest capital loans. So please contact me if you'd like more information about that opportunity. Next slide, please. These are some next steps and key dates for your information, also found on our website. We just want to remind you again to thoroughly review our grant criteria and guidelines on the website. You can schedule directly from our website a call with one of our grant making team members, and you can select the staff person that's overseeing the area that you're interested in. We also know that a lot of time goes into preparing your requests. We encourage you to speak to a staff member to determine alignment. And this is probably obvious, but a green light to apply does not guarantee funding. April 1, our application portal goes live and you can begin your requests on that date. The deadline and the date the portal will close is midnight on May 10th, 2022. Late or incomplete grant applications will not be considered. If your application does not meet our guidelines, you'll receive a notice of early declination shortly after the May 10th deadline. Reviews and site visits will take place through early July, and our board will make the final approvals mid-August, after which you will receive your notification. Most contracts, like I said, will start September 1, with the exception of our one-year grants that end in December 31 of 2022. A recording of today's call will be available shortly. It'll be available early next week along with our FAQs. So finally, let's move on to the question and answer portion of our call. We'll take questions in the chat box, but you're also welcome to ask your question to the group. So I'll just ask one of my team members to let me know if there are any questions and maybe read it out loud from the chat box, and we'll also see if any of you have questions. And I would recommend you raise your hand on your Zoom options if you do.
Yeah, Lori, we have one here, and one is we have a few, but I'm gonna go ahead and answer the one directly regarding the toolkits. The kits that we will be making available on the website. Well, the question is, will the kits or tools that we're going to have available on the website be in Spanish? The answer is yes. And we hope to also make it available in other languages, but for sure it will be in English and in Spanish to answer your question. And then we have another question. Our organization is seeking funding for veterans of our area for dental care. Is this the right webinar? Dorothy, I don't know if you want to come off mute and probably elaborate a little bit on what I guess, or actually, I'm wondering if you should just go offline and kind of connect with one of us so that we can help guide to see if this is indeed a good fit for you in any of our initiatives. So I would encourage you to reach out to one of us and we can answer your questions specifically regarding your proposal and fit with some of the initiatives. Looks like we're on. Yeah,
okay.
the next one.
Yeah, so is the geographic restriction for East Denver and San Luis Valley specific only to the place-based access to care component, or more specifically, is the prevention of tooth decay funding available to all of Colorado? Good question, and yes, prevention is a statewide initiative across Colorado, as well as in our place-based areas, but I recommend you reach out to Mara and have a call with her. So yes, you're eligible. Oh, thank you. Veronica responded yes and yes. Okay.
The There's another question. Yeah, Lori, if you want to answer it, or
is that Nathan's question? Mm-hmm. Okay, will these grants fund existing dental health programs? For example, if we are already providing dental health services, but need additional funding to supplement, sustain, or expand services. Well, again, it depends on what your where your program is and what age group you're providing. So we'll need to know that. And yes, but in terms of existing programs, we will fund them. I would recommend you speak to us so that we know that your program is aligned with one of our initiatives. Does anyone else have anything to add to that? Okay. Alyssa is asking if it's possible to or encouraged to submit proposals for different or multiple initiatives. Yes, we will consider that. But again, I encourage you to talk to one of our staff members to walk through that and see what it looks like. But we will consider that. Teresa asks if the criteria are on the foundation, and they are. You can find all this information there. So take a look, and if you don't see the answer to your question, please call us or please set up a time to talk to us. Anything else? Great. Well, let me close up. Let's see. How sophisticated of financials are you looking for? We are not looking for sophisticated financials. Even if you do them on Excel, submit that. If you don't have something, or let's say your books aren't closed yet, or you're not really sure what, if you're not using, let's say, QuickBooks or one of those other standard bookkeeping system, what I would suggest is you reach out to us, talk to your program officer about what you have available. We don't want, like, you don't have your updated balance sheet. We don't want you not to apply. So give us a call and we'll talk about that. It's not, I think, about sophistication. It's just about core information that we need. So I'm sure we can figure something out.
And then an additional question in the chat is it possible or encouraged to submit proposals for different and multiple initiatives?
Oh, did I not answer that? I think I answered that, Veronica. But yes, just to reiterate, you can apply if you're an organization under multiple initiatives, but do speak to us so that we know it's coming and we know that there's strong alignment. Great. If all the information, even after all the information you heard today, you still have questions about our initiatives, please call us. And even if you're clear and you just want to let us know it's on its way, talk to the staff member who's overseeing the initiative of your work. And we're happy to chat more. And if there aren't any final questions, we'll say thank you for coming. Thank you on behalf of Mara, Mireya, and Veronica, and the Delta Dental of Colorado Foundation team. We look forward to your partnership, and we thank you for all the important and amazing work you're doing. Thank you.
Thank you.